I'm Philipp Nakov. I'm a physician from Germany, and I'd like to talk to you about one of our research topics at the moment about liquid biopsy in Waldenström's disease. These are all analysis from the ECWM2 trial. And I'll just go with you quickly over what is liquid biopsy and how we are using it at the moment in the context of this trial, and what are the future implications for therapy and monitoring of the disease. First of all, liquid biopsy is a blood test. So it's just assessed by a simple blood draw where we're analyzing cell-free DNA. Cell-free DNA is DNA which is released from cells all over the body into the bloodstream. And it also includes fragments from tumor DNA, and that's what we're calling circulating tumor DNA or ctDNA. And this DNA is the stuff what we are looking at exactly because it has everything from the tumor or all genomic alterations which are interesting for diagnostics, for therapy monitoring, and also for analysis and progression. What are the advantages, or why do we need this liquid biopsy? It's first of all very easy. It's minimally invasive. So you can, as I said, just get it by a simple blood draw. It's very fast and safer than a traditional biopsy from, for example, bone marrow or from lymph nodes. How do we use it? So at diagnosis, we just take a simple blood draw and then we're analyzing different markers. And these markers are tumor-specific, and we're looking at disease-specific markers, for example, MYD88, which is very specific for Waldenström's disease, or CXCR4, even TP53. These are all mutations which are recurring in Waldenström's disease, and we're compiling a unique signature of all these mutations. So all these mutations together form a sort of signature from your tumor, which you can monitor in the bloodstream and also use for diagnostic and prognostic purposes. For example, if you then see there's MYD88 in the bloodstream, you can say, okay, it's very probable that there's Waldenström's disease somewhere in the body, although it's a bit difficult to distinguish it sometimes from other lymphoma entities. And it's also prognostic in the sense that, for example, if you see other mutations, you can say, okay, maybe the disease course is going to be a bit more difficult, and maybe the treatment needs to be a little bit different because there are some adverse prognostic markers. When we have these markers at the beginning, then maybe the patient starts a therapy, and then you can analyze these markers at every single time point and see whether the tumor is decreasing or the tumor burden is decreasing by these decreasing markers. It's a little bit like the IgM monitoring, the paraprotein, which is also used for therapy monitoring in the blood. But we are trying to measure the tumor by this liquid biopsy a bit more directly and see a bit more directly how the treatment is affecting the tumor. At some point then, you would enter a therapy-free interval after you finished your therapy and your tumor burden is very low, where you can continuously monitor this, the tumor by this liquid biopsy and see that it's still suppressed, that it's still a low amount. And then at some point, we hope to detect relapses very early so that you can, again, see if the patient needs a therapy maybe before bad symptoms start. And yeah, you can just to detect the relapse before it's clinically significant. Why is it so important to test this liquid biopsy within a clinical trial? It's important, of course, because you need to test whether it's accurate and reliable. What you're measuring is truly helpful for the patients, and you don't want to draw the wrong conclusions. For example, does it really mean if there's a low tumor burden by this liquid biopsy, by the ctDNA, that the patient really has a better outcome or does not need a therapy compared to if there's a high tumor burden? And that's all that needs to be established first before you can really use it for the clinical routine. We hope at some point to do even treatment guidance that you, for example, you can say you're getting a therapy for 1 year, you see the liquid biopsy is negative, and then you can say, okay, maybe we can stop the therapy. That's one of our goals for the future. But first of all, it needs to be established in these clinical trials and also in large clinical trials. So to conclude, our liquid biopsy is still under revision, but it has the value, or we hope it's a valuable tool in the future to manage Waldenström's disease. For example, for monitoring the disease, for diagnosis of the disease, to track treatment response, and to detect relapses early. And for this, we're working together in these clinical trials to ensure it's a safe and reliable method. Thank you very much.